Ryan, some really interesting and timely new reporting in DropSite on Dr. Oz's plans for Medicare.
Yes, Dr. Oz wants to privatize Medicare. Let's put up this tear sheet from Alexander Zajic investigation that we published over at DropSite, and we'll come back to this in a moment to explain the details of this privatization plan, which is not a harebrained scheme that has little chance of success. Our assessment is that he is quite likely to be able to actually pull this off if there's no resistance to it. But so if we put up B2, he cruised through his Senate confirmation hearing yesterday. It was this one of these interesting situations where the hearing room was busy doing some Social Security stuff and he couldn't meet there, so they met on the Senate floor. They kind of go off to the side of the Senate floor and they just kind of like hold a vote. And so he moves forward. And here is a bit from previously when they did have the hearing room. So we can roll B3 here.
Dr. Oz has years of experience as an acclaimed physician and public health advocate. His background makes him uniquely qualified to manage the intricacies of CMS. At his hearing, Dr. Oz discussed his vision to ensure CMS provides Americans with access to superb care, especially our most vulnerable patients. I look forward to working with him, if confirmed, to accomplish this goal. I was also encouraged to hear that he will focus on modernizing federal health care programs, work to fix our broken clinician payment system, and will partner with Congress to achieve pharmaceutical benefit manager reform. There is no doubt that Dr. Oz will work tirelessly to deliver much-needed change at CMS. I will be voting in favor of his nomination, and I encourage my colleagues on both sides of the aisle to do the same.
Okay, so on the Medicare privatization scheme that Dr. Oz is pushing, and we can put up B1 again just for a few seconds so people can see this again. You can go read the full story to get all the details of it.
Well, and can I ask you?
Yeah.
You just said is pushing.
Yeah.
To that, like currently, this is something that he right now believes in his capacity at this job.
Yes.
He can push.
Yes, and he does not need legislation to do it. Mm-hmm. And so here's how. So if you're old or you know somebody old, you probably have heard of Medicare Advantage, which now roughly half of seniors on Medicare have what are called Medicare Advantage plans. So these are administered by private companies, which are given a set amount of money by the government, and then if they can deliver care, for the way they profit is by delivering care that costs less than that. The way they sell it to you is they say, we're going to do preventive stuff. We're going to make sure that you get your checkups. We're going to keep you healthy because to us, we profit if you don't use healthcare services. And in order to not use healthcare services, that means you're healthy. That's great. Like if that is how you keep healthcare costs down, that's what everybody wants.
Right. People
don't want necessarily cheap or affordable healthcare services. What they would like is no healthcare services. You don't want to be in the doctor's office or the hospital. What happens in practice, though, is that it's much easier to just deny people care. That it's because it's much harder to upfront make sure that people are staying healthier. Now, Medicare, actual regular Medicare, is not allowed to advertise. It's not allowed to go out and recruit people to its program. Medicare Advantage spends a lot of its money advertising its Medicare Advantage plans. And they say, join us because we'll give you dental and vision and we'll deliver groceries to you. Like they have all these other little pluses that when you're healthy, you're like, oh, that sounds great.
Right.
And so they sign up for these privatized plans, and then they love it until they come to actually use the plan. You're like, oh, that's not in network. The only in-network person is like 120 miles from here. That's not covered. And so you get the typical private insurance nightmares, but even in your public health care plan, and now you're stuck in this. Now you're stuck in this situation. Dr. Oz has been a pitchman for Medicare Advantage for many, many years, like on his programs, and because Medicare Advantage, there's so much profit in signing these old folks up to it, they would go out and they would hire these pitchmen all over the country. Say, look, you bring us somebody, we'll pay you. Like, you get a finder's fee. Like, just same way if you sign somebody up for Squarespace or whatever on your podcast and you get $10, Like sign somebody up for Medicare Advantage who watched Dr. Oz's show, we'll give you $2,000 because or whatever it is. So there's an enormous amount of money in signing somebody up for Medicare Advantage. So he's been entangled with this for a very long time. He also, of course, owns like something like $600,000 in United Health stock, which he has said he would sell. They're a significant player in Medicare Advantage. Now, the irony is that Dr. Oz's ability to privatize Medicare comes from the Affordable Care Act. Obamacare set up these pilot programs that said, because one of the driving impulses of Obamacare was how do we deliver better health care for less? And so they said, we're going to set up a pilot program. And if this private company or this nonprofit can show that it actually is making people healthier, then we will expand access to that program. And so there are a number of pilot programs that are running through what's called CMMI, Medicare and Medicaid Innovation, I think it's called. And what almost all of them are finding is that Medicare Advantage delivers worse outcomes for more money. Yet the private companies make decent, healthy profits off the top of it. That's what the pilot programs are showing. All Dr. Oz will have to do is come in with a rubber stamp that says successful and rubber stamp those projects. And it's a subjective decision that will be left to Dr. Oz to say, I find these to be successful.
Right.
And then boom, they're wide open to everyone in Medicare Advantage. And then the last thing they would have to do is just default every senior into Medicare Advantage and make them kind of actively move out of that into regular Medicare. And because Medicare has no capacity to advocate for itself, within a couple of years, you would go from 50% of people on Medicare Advantage to almost everybody on Medicare Advantage. And by then, once you're down to 20% of people on Medicare proper, it no longer doesn't have the economies of scale anymore, and it just completely collapses, and we're left with privatized Medicare.
And so my personal perspective on this is why our healthcare system is the worst of both worlds. You end up with the worst of a market system, or for quote unquote free market system, and the worst of a bureaucratic system when you have these halfway measures. It's just such a disaster. Such a good example of why it's a disaster. But also, Ryan, you mentioned this doesn't have to go through Congress.
Right, because the authority for it is vested in the Affordable Care Act, which already went through Congress.
That's interesting.
So the ACA says if these pilot programs are successful, they can be then expanded by the head of CMS. And the head of CMS runs CMMI, which runs these pilot programs. And so Obama gave Dr. Oz the power to privatize Medicare.
Why isn't DOJ taking it away?
That's actually a very good point. The Department of Justice is currently suing a bunch of Medicare Advantage scammers to the tune of tens and hundreds of billions of dollars. If Elon Musk and Doge, or whoever is running Doge, wanted to actually sniff out some real savings and some real waste, fraud, and abuse, Medicare Advantage is one of the first places anybody serious about going after fraud would go. Instead, we're going to just expand it to what Dr. Oz calls Medicare Advantage for all. So yes, if you're serious about waste, fraud, and abuse, this is the place to go.
Meanwhile,
and yet they're not. So draw your own conclusions.
Trump's the guy Trump picked to head up Social Security, his name is Frank Biznano. He's CEO of Fiserv, actually, which is an interesting sort of person to pluck from. But anyway, meanwhile, this is just yesterday. He is saying that they will, restore any customer service glitches, but they're not going to cut Social Security. Donald Trump has said, obviously, that's his red line, but you can see how the Oz plan is pitched as something a little bit different, right? That Donald Trump might not look at that and say, okay, this is cutting, right? It's actually something that you could see being pitched to him and him going along with.
Yeah, and Trump is a pitch man,
like Dr. Oz.
Yeah, the only reason that Trump hasn't sold Medicare Advantage plans and nobody got in front of him with the idea. And maybe they did, we just don't know about it. But yeah, Trump would understand this. Oh, so we're going to offer them some surface level benefits. You know, we'll mail you a toothbrush and you can get groceries delivered and you get dental coverage. Good luck trying to use that dental coverage, by the way. But it looks good, it sounds good. And then we get to keep all the money by denying them care.
Yeah.
Like it's like a classic scheme that a private equity company can use because of this massive asymmetric warfare. On the one hand, you've got a private equity company with a bunch of McKinsey-level quant geeks who have these spreadsheets in front of them and figuring out, how best to maximize their profits. And on the other hand, you have, on the other side of the ledger, you have grandma and grandpa who are just going to get just annihilated in that competition. Like that's not a marketplace that's going to be fair.
All right, well, that's one to watch because he's headed to the full floor and is likely to pass. Hey, if you liked that video, don't forget to hit the like button and subscribe to Breaking Points.
If you want to see the rest of Counterpoints, go to breakingpoints.com to become a premium member and get the full uncut show every morning in your inbox and on Spotify.